Scientists are hopeful a drug they've used to treat cancer might also work to fight COVID-19. Our national investigative team talks to one of the researchers and looks at parts of the country seeing big jumps in cases. Here's Investigate TV's Lee Zurich with our COVID-19 tracker.
Boston is now past Detroit and is right behind New York and New Orleans as the third largest hotspot metro area in the country. This chart mapping out positive cases shows you the curve in Boston is not flattening. When you compare this week to last, positive cases in the Los Angeles area have spiked 107%. Little Rock 203, in Green Bay 206%. As we travel through time, you can see the number of COVID-19 cases in our country growing. The darker colors indicate more positive cases per capita. And as we go from 4 weeks ago to 3 weeks to 2 to last week to today, you can see the virus traveling through most of the country. While a vaccine might end this spread and pandemic, doctors across the country continue to test drugs that might help sick patients with the virus. At the University of Louisville, researchers believe they've developed a technology to block coronavirus from infecting human cells.
So is this something you take before you have the virus or when you have the virus?
If you had the infection and have gotten ill but not seriously ill yet, you could take this and hopefully it would prevent you from getting much worse.
The synthetic DNA molecules have been used as a potential therapeutic against cancer. Researchers tested it with coronavirus in a lab.
The idea would be, when a cell gets infected, the virus replicates and creates more virus, and that infects the cells around it. And so you would stop that process and hopefully stop the spread of the infection in the body.
The university hopes to start trials in a few months to see if it works on humans.
There's good reason to believe that if you had a severe disease and a lot of virus throughout your body, and you took this, it might reduce the kind of viral load in the body and make you feel better.
And if so, it might stop hotspots from popping up if the virus continues to infect the population.
For now, the University of Louisville is funding the COVID-19 research, but it also is taking donations specifically for the project. Up next, tens of millions of Americans have received their stimulus checks, but millions more have not. What's holding up the money and what, if anything, can be done?